okay? Okay, so what if you get diagnosed with diabetes? What does it mean for you? Why do we care? Why are we talking about this? Well, as many of you have heard, a diagnosis of diabetes does carry consequences, especially if it's poorly controlled and you don't have good medical care. So poorly controlled diabetes, unfortunately, can lead to multiple complications, such as amputations because of nerve damage and damage to the blood vessels in our legs, blindness because of damage to the blood vessels in our eyes, kidney failure, other kinds of nerve damage, heart disease, a big, big consequence of diabetes, stroke. And if a woman is pregnant with diabetes, especially if she doesn't know it or if she hasn't been well controlled, then it can lead to birth defects. Luckily though, if we control our diabetes, all of these complications can be avoided. Okay? So, but it does require work and regular medical care. So complications can be prevented entirely. First of all, with diet and exercise. Sometimes that's all people need if they have diabetes. They don't need to take anything else. And we'll talk about what kind of things you can do as a first step. Glucose control, and again, that can be done just with diet and exercise or with pills or insulin. Blood pressure control has been shown to help prevent complications of diabetes, cholesterol lowering, regular foot care, because especially as the small nerves in our feet start to get damaged, we want to make sure it doesn't lead to ulcers, infections, and eventually amputation, so you got to take care of your feet. Your eyes have to be examined regularly to look for early signs of what we call retinopathies to prevent blindness. And of course, as I mentioned, for a woman who has diabetes, really planning her pregnancy, making sure that her blood sugar is optimized before she gets pregnant. So how do we do all that? What does management of diabetes mean? So, the first thing, of course, is diet control, and anybody diagnosed with diabetes should have at least one visit with a dietitian to talk about their diet, make sure there aren't things that they can change, make sure they're educated about what the right diet for them is and what changes they can make for their own diet, and we'll talk about the general recommendations in a moment. A person who has type 1 diabetes will be taught how to count carbohydrates to help manage their insulin. Regular exercise, of course, and so, you know, we do recommend at the minimum, and we'll talk about this more later, that everybody gets at least 150 to 175 minutes of moderate exercise a week. So it could be, you know, 20 minutes most days of the week, 60 minutes a couple of days a week, but you should get regular exercise, and it doesn't have to be intense, moderate. In other words, just enough to work up a sweat and get your heart rate going. Like I said, if your glucose levels remain high after making changes to your diet and lifestyle, you know, many doctors will prescribe pills or insulin to control the diabetes. In fact, most people do need medication eventually. We do recommend that people learn to monitor their glucose at home. We have these lovely monitors where you can check your sugar just with a little prick on the finger and put it on a little test strip, and it tells you what your sugar is, which is a really great tool for people to see how their sugar is varying day to day. However, if your diabetes is fairly well controlled with pills, there's no evidence you need to do that on a regular basis, but it's good to have a monitor and actually know how to use it. And of course, if you're on insulin, we do recommend you monitor regularly. Blood pressure control is key. Studies have shown that the single most important thing that if a person with diabetes can only do one thing, it's to get their blood pressure under control, because that has been shown to actually not only reduce heart attacks and kidney disease and eye disease, but it's actually shown to prevent deaths. So most people think they have to do all this work to take care of their blood sugar, and yes, they do. But the best thing you can do at the first step is really getting that blood pressure under control. And whether it be, again, through diet and exercise and weight loss, or through pills, but you got to get that blood pressure under control. And cholesterol control is becoming very important as well, and many people with diabetes do require a cholesterol drug, not because their cholesterol is necessarily higher than average, but because we tend to have different targets for people with diabetes, because we want to be more aggressive, because we know that taking a cholesterol drug actually lowers your risk of heart attack and death as well. And of course, foot care, as we mentioned. So inspecting your feet on a regular basis, having someone do foot care for you if you need it. So what do we recommend for people who have diabetes? So we do recommend that they visit their doctor. Usually a family doctor can take care of diabetes every 3 to 6 months. And for that, they should review their diabetes control, have a physical exam, have their blood pressure checked, and do a glucose test called an A1C and a urine protein to make sure that their kidneys aren't starting to become damaged. And then the tests we recommend on an annual basis are your cholesterol profile, and some people will do it more often, but at least once a year, having a foot exam at least once a year, and an eye exam once every 1 to 2 years, depending on your diabetes control. Okay? And sometimes your family doctor will advise you to will recommend that you see an endocrinologist like myself if the diabetes is becoming, the control is deteriorating and there's more complexity to the care and they need the expertise of an endocrinologist. But usually the endocrinologist will work in kind of a shared care fashion with the family doctor, and if the diabetes can sort of stabilize, then oftentimes the patient can then continue to be cared for by their family doctor. Now, there's also something we call diabetes self-management. So it's not just about going to the doctor, getting blood tests, having your blood pressure checked, but it's all about what we do on a day-to-day basis to take care of our own diabetes. And to help us learn how to manage our own diabetes, we recommend that all patients diagnosed with diabetes visit a diabetes education center and have some counseling with diabetes education teams. And these are available to all patients with diabetes. We have one here at Women's College Hospital for the patients that we see, but all family doctors should have a diabetes education team available to them, either through their own family practice team or through the community. Okay, and these people consist of advanced practice nurses with specialization in diabetes care, dietitians, and often social workers, sometimes exercise counselors, sometimes they even have psychologists, depending on the needs of their community. And people in the diabetes education teams can help people learn how to self-monitor their glucose with those monitors, show them different monitors and help you choose one that's right for you, help you interpret the results and have a go-to person if you have any concerns about the sugars. They counsel you regarding your medication and your adjustment of those medications, particularly insulin, because many people who are on insulin have to take multiple injections a day, and so the diabetes education team is actually key to help support people as they're taking insulin. They'll teach you how to care for your feet and provide you with resources in the community, and they give diet and exercise counseling, of course. So that was a real brief overview of management of diabetes, okay? And just to point out that if people do follow those recommendations and they see their doctor regularly and they work hard at self-management, in most cases complications can be averted and diabetes control can be maintained. But in some cases, even with the best intentions, diabetes control does progress and people do get worse. And in fact, over time, studies have shown that most people with type 2 diabetes do require more and more medication. So we do recommend that people, first of all, don't get discouraged if they're finding that their control isn't as good as it used to be, despite all their best efforts, and also that they don't give up, that they keep at it, they keep working with their team, they keep at the self-management. It can be hard, but we do have supports for people to help make sure that we can address these issues as they progress. And if we continue to work with people as their diabetes progresses, we can continue to avert complications. Okay? So what about people without diabetes? So let's just talk a little bit about how diabetes can be prevented if you don't yet have it. Okay, so there is lots of evidence to show that we can prevent type 2 diabetes from happening in high-risk people with maintaining a healthy lifestyle or lifestyle modification and weight loss for people who need changes. So maintaining a healthy weight, in most cases it means having a body mass index ideally under 25, which is your weight in kilograms over your height in meters squared. And then if you're overweight, weight loss with an eventual goal to get down to that BMI. But I should point out that the studies have shown that a 5 to 10% weight loss is enough to prevent diabetes by 60% over 4 years, compared to people who didn't lose weight in the studies. So you don't have to go back to, you know, your 18-year-old self to avert diabetes. Basically, 5 to 10% is sometimes enough just to reduce the metabolic stress on our body. And then you do that simply, you know, it sounds simple, but by working hard at maintaining a healthy diet and regular exercise. So what does all that mean? So what are the lifestyle recommendations? And I should point out that these recommendations are for both prevention and management of diabetes. So we give the same advice. So what's the recommended diet? It actually isn't very different than the recommended diet for the general population. So it's not like there's a special diet for people with diabetes. Certainly we do specifically recommend that people avoid very high sugary foods, because they can really spike the blood sugars in people who don't make enough insulin or have trouble tolerating insulin. Or tolerating glucose. However, in general, these are recommendations that probably should be followed by everyone, regardless of whether or not you have diabetes. And so, very simply, the recommendations is that no more than 50 to 60% of our meals should be consist of carbohydrates. And I've put sort of the green and the yellow parts of the plate up there to give you examples. So fruits and vegetables should be a good part of your carbohydrates. And then you should choose low glycemic index choices as much as possible. And I can answer questions after about low glycemic index later. But basically, the brown carbs, you know, whole grain rice and whole grain bread, whole wheat pasta, and you know, sweet potatoes. Avoid the white starches as much as possible. And 20 to 30% maximum fat. We no longer recommend low-fat diets, because now we recognize that some amount of fat is important for vitamin absorption, is also for appetite suppression. So we do say you should be taking in a little bit of fat, but no more than 20 to 30%, and to choose unsaturated choices. Protein, 20 to 25%, and that doesn't just have to be meat and poultry and fish, it can also be dairy, legumes, eggs, and then to get enough fiber. And adequate calcium and vitamin D has actually been shown to help control weight and avoid diabetes. And what about weight loss? So for those of us who are overweight, we do recommend weight loss. We know, as I've told you, that 5 to 10% weight loss can reduce your risk of diabetes by 60%. And in some cases, weight loss can actually, a significant weight loss can actually reverse diabetes in people who've been newly diagnosed. So diabetes can be reversed. And a recent study was published showing that, just was published in December, I think, of 2012, in the Journal of the American Medical Association, showing that when they took people with newly diagnosed diabetes and gave them a lifestyle coach with the goal to increase their physical activity, improve their diet, and lose weight, that they were able to reverse diabetes in some of the people significantly. And then, of course, how do we lose weight? Well, it's very simple. We reduce our calories and we increase our physical activity. That's kind of the simple rule, right? And generally, if you want to lose weight at a healthy rate, we say to take in no more than about 12 to 1,800 calories per day. Most of us are getting more than that. We don't recommend very low-calorie diets. They have a high rate of failure, as many of us have probably experienced. And another rule of thumb is that if you can cut out about 500 calories per day from your diet, so whatever you're at, if you can cut out, if you're taking 3,000 calories a day, go down to 2,500, you will lose on average about a pound a week. And we don't recommend to lose more than that, because it's less likely to be sustained. And basically, it's, you know, how do you reduce your calories? Well, you try hard to make healthier choices that have lower calories, and that are more likely to make us feel full, and to watch our portions. So how do we avoid overeating? Most of us are getting too many calories because we're eating more than we should. We don't pay attention to our cues. There are many reasons why we eat besides for sustenance and hunger. And so there's actually a really good book that if people want to learn about this whole idea of overeating, called Mindless Eating by a psychologist named Brian Wansink. And he's written this really interesting book where he's done a number of experiments showing how all of us are vulnerable to overeating with the right environmental cues. And so he's given some tips on simple tips on how to avoid overeating. And in the interest of time, I won't go into too much detail, but some of the things he recommends is don't put food on the table when you're sitting down to eat, because you're more likely to serve seconds and thirds or pick at it. Don't leave food within reach, because you're more likely to eat mindlessly without thinking. And don't feel the need to finish your plate. I don't know about you, but I was brought up to finish my plate. And so I lost, the external cue, I lost the internal cues to know when I'm full. So now I have 3 kids of my own, and I have to really resist the urge to tell them to finish their plate when they've had 3 bites and they tell me I'm full. But I want them, my mind tells me I want them to learn how to pay attention to their cues. But of course, as a good mother, I don't want them to go without eating. So it becomes very difficult. But at the same time, it is true that we have to let people, we need to learn to pay attention to our hunger cues and don't feel the need to finish our plate. Do use a smaller plate. He showed that if you use a smaller plate, you're less likely to overeat. Do sit down to eat. None of this standing at the counter and eating. Try to cook more at home. Many of us eat out far too often. Bring lunches from home, snacks from home, so you're not, feeling that urge at 3 o'clock to go to the vending machine. And studies have shown that keeping a food diary really helps. So writing down everything you eat, or just knowing that you have to write it down, is going to make you more likely to think before you eat. And beware of risky situations. We all know them: restaurants, vending machines, being tired. After exercise, we feel famished and we figure we can eat as much as we want. Now we've exercised, but basically you negate the effects of the exercise. After a busy day, you're tired, you don't feel like eating healthily. Long periods of fasting. Don't go more than 3 hours without eating, because then you're going to make bad choices. Emotional eating. Many of us eat when we're stressed or depressed or upset. Eating becomes that sort of soothing thing. And eating as a reward. If you've had a hard day, you're going to go out for a big dinner or have a bowl of ice cream or to celebrate, but you're not really doing any good to yourself if you want to lose weight. And of course, boredom. Okay, and how much exercise? So I mentioned to you what the minimum amount of exercise that really we should be doing to maintain a healthy weight. It's here, 150 minutes a week, or 60 minutes of vigorous exercise. And there are some pictures there to give you an example of what moderate versus vigorous versus light exercise is. It's kind of small. And if you want to lose weight, you got to exercise more than that. So another very important point, you're not going to lose weight if all you do is exercise, unless you exercise an awful lot, okay? So you can lose weight if you both reduce your calories and you exercise. But exercising alone is not going to result in weight loss unless you exercise 250 to 300 minutes a week. So sure, some people do, like these people who start running on a daily basis, they can lose a lot of weight, but you really got to exercise a lot. And so most of us don't have time to exercise. So really, these are things we already know. Just really try to fit in time to exercise. We got to schedule it in like we schedule everything else. Find a regular time, either whether it be the early morning, after work. Some people exercise before bed. I have a colleague, after her kids go to bed, she exercises at 10 o'clock at night. I couldn't do that, but that's the only time she finds, right? And just schedule it in. Schedule in like your doctor's appointments, like your meetings with your friends, like your work responsibilities. And of course, do something you enjoy. If you don't enjoy it, you're not going to do it. Make it convenient, make it somewhere close to home, make it in your home, at work. And accountability helps. So if you have a friend or a buddy or a group that you exercise with, or your husband or your partner or your children, you're more likely to do it because they're counting on you and they're expecting you. And then find opportunities during the day just to be more physically active. Take the stairs. This is kind of a missed opportunity here. Everybody taking the escalator where the stairs are completely empty. People just, as I said, you know, that's how we're engineered, right? We want to conserve energy. You know, and find ways to exercise while you work. You know, one of these exercise balls, while they don't help us burn calories, at least they help, you know, with muscle strength and core fitness. And then the last slide that I wanted, oh, actually it's not the last slide, but one of the last slides, was just to briefly tell you about bariatric surgery, because that was one of those questions. So bariatric surgery is a weight loss surgery, okay, where they do either gastric banding, so they band the stomach to make it smaller, or they bypass your stomach. And this reduces your stomach size, it reduces your appetite, and it reduces absorption of the food that you take in. And they found that people who have this procedure can have an average of 60 to 90 pounds of weight loss. It's surprisingly very successful. And it's been shown that it can reverse diabetes in people who do lose that kind of weight, and it improves mortality. So because of this, Ontario now has a bariatric surgery network, and bariatric surgery is now covered and recommended for anyone who has a body mass index over 40 or over 35 with diabetes. Now, there are strict guidelines about who will be eligible, and there's a long wait. So for example, you have to show that you're going to be able to maintain a healthy diet afterwards, because it becomes very difficult to, your diet has to change dramatically when you have this surgery, and you have to show that you've tried other methods of weight loss. So to finish off, I'd just like to tell you about our new Center for Integrated Diabetes Care at Women's College Hospital and how we can help people with diabetes. So we have a multidisciplinary diabetes team that is dedicated to the care of special patient populations with diabetes. So as I told you, family doctors see most patients with diabetes, but we are available for those patients who have special issues. And we have in our team advanced practice diabetes nurses, dietitians, we have a social worker, exercise specialist, and we have 9 endocrinologists working here at Women's College Hospital. And these are 3 examples of some of the diabetes programs we have here at Women's College. One of them is our Integrated Complex Diabetes Program. And this is a program where people who have complex care issues related to diabetes or poor diabetes control can come in one visit and visit every member of the team to help them get their diabetes under control and address some of these issues. And they get ongoing follow-up by multiple members of the team. So it's a true team-based approach, including the endocrinologist. The Emerging Adult Program is another program that's specifically geared to young people with type 1 diabetes, those people with juvenile diabetes who are transitioning from pediatric to adult care. That is a very vulnerable time for this population, and so we provide them with intense support during that time to make sure they don't fall through the cracks. And then finally, we do offer lots of support for women. This is, even though we no longer have an obstetrics center here, this is a long tradition that we've had at Women's College Hospital. We continue to provide support for women who are planning to get pregnant with diabetes, who are pregnant with diabetes, and after they deliver, a woman who's had gestational diabetes, I mentioned, is at high risk of future diabetes, and we offer support with diabetes prevention for that population. So to finish off, we'll go through our true or false questions again. So how many people think diabetes is caused by too much sugar? Right, false. Diabetes can be prevented? True. Complications of diabetes are inevitable? False. And bariatric surgery can reverse diabetes? True. So, to finish off, take-home messages. Type 2 diabetes, as you know, has become an epidemic. It's a public health issue, it's an environmental issue. We're all at risk in some way or another. Like I said, most of us have at least one risk factor. Type 2 diabetes, but can be prevented with healthy lifestyle changes, and complications of diabetes can be avoided with good diabetes care. Thank you.